After the first 4 weeks of life, the child is still in the process of adapting to their new environment. Asymmetry persists in the supine position, but is decreased compared to the newborn. During this time, the ventral musculature is more active, which causes the ventrally tilted pelvis to be pulled dorsally towards the neutral position. Additionally, this ventral muscle facilitation causes the chest to be pulled down inferiorly towards the pelvis. Gradually, mass movement decreases. However, the child still cannot perform any isolated movements. Compared to a newborn, a 6-week-old baby is able to isolate or differentiate the movement of their head from the rest of their body, primarily illustrated by head turning. Additionally, the ability to maintain constant optic contact occurs between 4 to 6 weeks of age and includes controlling and stabilizing the head in the midline, which is facilitated by the increased activity of the longus colli muscle. When the child can optically fixate on an object at its side, this facilitates the stereotypical fencer position, which is a distinctive part of physiological development during this time. The child's psychological desire to grasp the object facilitates a physiologic irradiation throughout the entire body. We see the global reaction of the associated grasp in the hand, mouth, and foot. It is important to remember that the physiologic reaction observed in the fencer position should not be confused with an asymmetric tonic neck reflex, which does not belong to normal typical development.